Hello everyone. Today I'll be discussing about types of radiographic faults. So these faults come under projection errors, exposure errors and processing errors. We know whenever we have to take the radiograph of a patient, we first of all ask him to sit on the dental chair. Then we place the film inside his mouth according to the tooth which is to be radiographed, and then we position the PID. So any of the errors during this procedure will come under the projection errors. So after preparation of the patient, positioning of the film, and the technique, we go and stand behind the lead barrier and we expose the film. So any of the errors which occur during the exposure will come under exposure errors. In this, we have to take care of the exposure parameters, that is milliampere second, uh, and voltage. Okay, then comes the processing error. So after we have exposed the film, we take the film outside the patient's mouth and then we go to the dark room to process the film. Okay, so any of the errors which occur during that during the processing procedure will come under the processing errors. So let's begin with the projection errors. Coming on to the projection errors, first comes the patient preparation errors, and one of the errors in the patient preparation will be a blurred image. So if this is the patient and this is the film placed inside the patient's mouth and this is the PID, movement of any of these can lead to a blurred image. That is, if the patient moves while we are exposing the film, if the film moves inside the patient's mouth while we are exposing it, or if the tube moves while we are exposing the film, all of these, movement of any of these can lead to a blurred image. So what are the causes of the blurred image? Movement of the patient, for example a child patient or patient having neurological problem, movement of the tube, or movement of the film inside the mouth. So how do we avoid getting a blurred image? First of all, we can use film holders, and then we have to instruct the patient not to move while we expose the film. Another cause for a blurred image can be its double exposure. That is, we have exposed the film and then we completely forgot that we exposed the film, and the patient came and we placed the same exposed film inside the patient's mouth and then we re-exposed it. And then when we process it, the image which will be formed will be a blurred one. So this was about the blurred image. Another error which comes under patient preparation errors is the radiographic artifact. So what is the cause of an artifact? Any of the dental appliances, for example RPD, that is a cast partial denture which is made of metal, or any of the foreign bodies, for example earrings, nose pins, clips or chains, which the patient is wearing while we are exposing the film, the images of such foreign bodies can appear on the film as ghost image. That is, they are radio opaque. So ghost image is radio opaque. So how do we avoid getting ghost images? We have to instruct the patient to remove the foreign body. This ghost image or radio opacity because of foreign object can sometimes be confused with condensing osteitis or PCOD, that is periapical cementoosseous dysplasia. Condensing osteitis is nothing but chronic focal sclerosing osteomyelitis, in which the pulp will be traumatic, the PDL space will be widened, and then there will be the breakage of the lamina dura, and then there is a radio opacity at the apices of the tooth. And then in PCOD, here pulp will can be normal, and then there is a radio opacity surrounded by ill-defined radiolucency along with the bone loss. So this radio opacity, which is due to the foreign object radiographic artifact, should not be confused with the pathological radio opacities, for example condensing osteomyelitis or PCOD. In the projection errors, first one is the patient preparation errors, under which we studied about the blurred image and radiographic artifact. Now comes the film placement errors. So the first one in this is apices cutoff. See, the radiograph should look like this. That is, the crown, root and apices and some part of the bone should be visible in the radiograph. However, if the apices are not shown in the radiograph, that error is known as apices cutoff. So what is the cause for such an error? Film is not placed apically enough. What does that mean? See, if this is an IOPA film, this is the white of the film which is placed towards the PID. This is the label side. It is placed towards the tongue or intraoral side. So if the film is not placed apically enough, that is, the film more than 1 by 8th of the film is placed above the crown, that is, it is not placed apically enough, that is, the root ends will not be captured in it. So how to correct such an error? We have to move the film away from the teeth. Only 1 by 8th of the film should be placed below the crown. So next one in the line is crown cutoff. In apices cutoff, apical third of the roots was not shown. So in crown cutoff, a part of the crown will not be shown. So what is the cause for such an error? Enough film is not placed above the crown. That is, the film is placed too far apically. Okay, the film is placed too far apically. So obviously this portion of the crown will not be captured in the radiograph. So how to correct this error? We have to place approximately 1 by 8th of the film above the crown portion of the tooth and then expose the film. The third one is area of interest not shown. This the cause for it is faulty film placement. See, if we have to capture the image of 4, okay, 1 4, the film should be centered over the 4 such that in the radiograph 3 4 and 5 are seen. Another film placement error can be a dropped film corner, tipped or tilted occlusal plane. So, cause for such an error is edge of the film is not placed parallel to the incisal or occlusal surfaces of teeth, because of which occlusal plane appears tilted. That is, see, whenever we have to take the radiograph, the edge of the film should be parallel to the occlusal. This is the occlusal plane and this is the edge of the edge of the film. These two should be parallel. If in case the edge of the film is not parallel, it is tilted, the occlusal plane in the radiograph will appear tilted, and that is known as tipped or tilted occlusal plane or dropped film corner. So another cause for such an error is the patient not holding the finger firmly against the tooth when finger holding method is used. Finger holding method means when the film holder is not available and the patient uses his finger to hold the film is in place. So how to avoid such an error? We have to instruct the patient to hold the film firmly, and edge of the film should be placed parallel to the incisor occlusal surfaces of the teeth. Another film placement error is reversed film herringbone effect or tire track appearance. See, before going on to that, let's see what is the normal configuration. See, if this is the tooth and this is the PID and this is the film. The film should be placed such that the white of the film, that is the tube side, this white of the film is also known as tube side. This should be placed towards the PID. If this pen is the PID, the white should be placed towards the PID, and this blue one should be placed towards the tongue, towards intraoral sides. Okay, this is the normal configuration. But if we reverse this configuration, we place the blue side is the label side and white side is the tube side. If blue side is placed towards the PID, the error which will occur is known as herringbone effect or tire track appearance. So what is the cause for such an appearance? See, this is the tube side and this is the label side. Okay, and when we open the film like this, first we'll see the lead foil. Okay, then there will be a black paper wrap in which the IOPA film will be embedded. Now this since this is placed towards the intraoral side, in the normal configuration, the X-rays will come, they will pass through the tooth and then they will pass through the black paper wrap, then the IOPA film, again the black paper wrap, and then finally to the lead foil. And lead foil will absorb the scattered radiations, because from this side the first thing you see is the lead foil. But if you reverse the configuration, the X-ray film, so the X-rays will strike the tooth and then directly to the lead foil. So most of the X-rays will be absorbed by the lead foil, and that will lead to the tire track or herringbone effect. Another film placement error is black dot in periapical area, also known as dot artifact. See, we saw that first one, the white of the film should be placed towards the tube side, and then this raised dot, which is also known as identification dot, it should be placed towards the occlusal surface and not towards the apical third. See, this is the occlusal surface. This dot should be placed towards the occlusal or incisal surface of the tooth. This identification mark should So, what is the cause of dot artifact? Identification mark placed on the apical third of the apical area of the tooth. This identification mark is now placed towards the apical area of the tooth. So, what will this cause? This will lead to the formation of a radiolucency on the apices of the apices of the teeth, and we can confuse it with pathology in the periapical area. So, how to correct a dot artifact? Always place the raised dot towards the occlusal or incisal third of the tooth. Another film placement error is double images on the radiograph. The cause is re-exposure of the already exposed film. So correction, exposed film, whenever we expose a film, it should be placed in a separate receptacle. So another film placement error is black lines. So what is the cause? Bending of the film leads to the black lines on the radiograph. So avoid unnecessary bending of the film. Another film placement error is the distorted image, and the cause for such an error is the bending of the film. See, if there is excessive bending of the film, the roots may appear dilacerated. So, excessive bending of the film may lead to distorted image, and this can be confused with dilacerated roots. While the roots are normal, see, roots are like this actually, but because of the bending of the film, the roots may appear dilacerated. Sorry, so the roots may appear dilacerated. So we are studying about projection errors, in which we covered patient preparation errors, film placement errors. Now comes the technique errors. In technique errors, first comes the incorrect vertical angulation. We have to remember certain angulations for bisecting angle technique. For maxilla, the angulations are, see, this is the molar side, so 20, this is premolar, 30 incisors, 40 and canine, 45, 20, 30, 40, 45, 20, 30, 40 and 45. And for mandible, if this is the mandible, then for molars, 5 premolars, 10 incisors, 15 and canine, 20. So minus 5, minus 10, minus 15, minus 20. So 5, 10, 15 and 20. 20, 30, 40 and 45. So, due to incorrect vertical angulation, there can be elongation or foreshortening. Elongation का cause is too flat vertical angulation of cone in bisecting angle technique, and for paralleling technique, elongation can occur if the film is not placed parallel to the long axis of the tooth. So, correction for elongation will be to obviously increase the vertical angulation and to place the film parallel to the long axis of the tooth in paralleling. In foreshortening, the cause is increased vertical angulation, and its correction will be to decrease the vertical angulation. Remember, elongation is due to flat vertical angulation, and foreshortening is due to increased vertical angulation. So, another error in the technique errors is incorrect horizontal angulation, which leads to overlapped contacts. Cause, central ray is not directed through the interproximal spaces. See, if these are the teeth, and this is the PID, the central rays from the PID should be directed through the contact points. If the central ray is not directed through the contact points, there can be overlapped contacts. So, like this. The central rays from the PID are not parallel to the contact points. So this can lead to the overlapped contact. So cause is central ray not directed through the interproximal spaces, and the correction, X-ray beam is directed through the interproximal region. This should X-ray beam should be directed through the interproximal regions. So another error is a cone cut PID alignment artifact. This is the most common error and occurs because of improper alignment of PID with the periapical film holder. So if this is the periapical film and this is the cone or PID, if this has to be placed like this, it has to cover the whole of the area. If this does not properly cover the area, this area will be unexposed. So this unexposed area on the film, on the processed film, will appear as cone cut, that is a convex white area. So cone cut, if the PID is properly positioned, cone cut will not be there, but But the improper alignment of PID over the film holder can definitely lead to cone cut, and it is the most common error. See, if this is the PID and this is the film. Here, this area of interest is not covered by the PID, and it will appear as a convex white area. So its correction is PID should be properly aligned. In the next video, I'll talk about exposure errors and processing errors. Thank you.